Hi guys, my name's Caitlin and I'm doing my project on substance use and abuse over Adult and Teen Challenge Baltimore's organization. So Teen Challenge is available internationally with over 1,000 centers in over 100 countries. The organization is non-denominational, Christian-based, and I've included the mission statement directly from the Baltimore Center's website here. It says, "Our purpose is to provide adults and families with an effective and comprehensive Christian faith-based solution to life-controlling drug and alcohol problems in order for them to become productive members of society. By applying biblical principles, Adult and Teen Challenge endeavors to help people become mentally sound, emotionally balanced, socially adjusted, physically well, and spiritually alive." The Baltimore location is actually called Adult and Teen Challenge Baltimore, and it's located right in the city, just about 10 minutes from Johns Hopkins. And the classification of services they provide would be rehabilitative/therapeutic at the tertiary level, because the population they serve already have issues related to drug or alcohol abuse. And their mission is to rehabilitate people and help them become productive members of society, as well as supportive services due to their program maintaining the health, education, and welfare of their participants. The website provides a brief history of the international organization and boasts being the oldest, largest, and most successful program of its kind in the world. The first was established in Brooklyn in 1958 by a pastor venturing into inner city New York City from Pennsylvania farmland, working with gangs and troubled youth. And he became aware of what Teen Challenge will continue to refer to as life-controlling issues that these young people faced, and he saw the consequences of addiction, including incarceration, homelessness, teen parenting, and poor family relations, and unfortunately, death. So the pastor established Brooklyn Teen Challenge as the first Teen Challenge Center. The shift from Teen Challenge to Adult and Teen Challenge at their Baltimore location seems as if it's still underway. There are some inconsistencies within the site that will use either one of these images or would refer to themselves as Teen Challenge for short or ATCB for short. But based on the trends that Jensen and Fraser provide regarding decreasing youth involvement in substance use and abuse, the shift makes sense. So the programs available primarily include their 12-month residential program, which has quite the regimented schedule and structured environment. So students will wake up at 6 a.m. for days filled with religious, academic, and job skills studies. This curriculum focuses on personal growth as well as group studies and mentoring. The other three programs are transitional from this 12-month program. So the first, the extended training program, lasts 6 months, where they actually become staff for a new group in the 12-month program. Sorry. This provides them room and board and allows them to remain in a spiritual and drug-free environment for at least 6 months longer. Plant, Grow, Reap, Re-entry is more of a housing agreement. They follow a daily schedule less regimented than that of the 12-month program, and they pay their own rent. They have set goals of when they'll graduate from the housing and fully re-enter society. Restoration is for those who need reinforcement after the 12-month program, and it's more tailored to the individual's needs. So it may last anywhere from 4 to 8 months, and students are required to complete an extending training program contract following their restoration. And so all of these three would fall under the category of continuing care, which Jensen and Fraser would suggest is a characteristic of an effective program. The website only provided the names and titles of the board of directors rather than the day-to-day employees that the program participants likely come in more contact with. But on the board of directors, at least, several of them are pastors, and surely all of them are Christian, considering the faith base of this organization. And as I mentioned before, some of the past program participants in the extended training program are the ones to provide meals and etc. for the new group of students. They do claim to treat any type of addiction, including gambling, sex, and others, as well as drug and alcohol abuse. So it seems anyone with what they call a life-controlling issue can apply to participate. Teen Challenge as an international organization says that they serve youth, adults, families, so regardless of gender, but Adult and Teen Challenge Baltimore actually only serves males 18 and older. And if you look through their website at student testimonies and success stories, or they have a short informational video about the program on their homepage, you don't see any teens at all. You'll see primarily adult Caucasian men. And I did come across this problem even when just looking for a program to focus my project on, because most substance intervention is targeted towards adults, it seems, excuse me, rather than to children and youth. This program is called Adult and Teen Challenge, but 18 and up is technically legally only adults. And our textbook would support this in a way because evidence shows programs for children should vastly differ from programs for adults. I'm so sorry. So programs for children and adults should differ, but our textbook would say that intervention should occur as early as possible for middle schoolers or high schoolers who are experimenting with tobacco or marijuana or even more harmful substances, as soon as possible. So it's kind of like, where is the program? Where are our programs for those 12 to 17-year-olds? Regardless, as the organization is a nonprofit, they likely receive a majority of their revenue from the general public, including individuals, companies, other charities, or from the government. The cost of the 12-month program per student is $6,175, but students can be sponsored, and the website provides plenty of information and links to those who wish to do so. The program aims to tackle social issues such as education. A big part of the 12-month program is the lessons and the study. Family relations, community support and functioning, because addiction disrupts interpersonal relationships. Crime and incarceration, because possession or use of substances might be a crime themselves, but they also might affect your personality, your judgment, and cause you to commit other crimes and end up in prison for a variety of reasons. And then mental health and death are big ones. So some people may use because of existing mental health problems, or they may develop mental health problems as a result of using. So all or most of the above could result in death in some way, but especially an overdose due to addiction. So just to quickly touch on policy following that, Maryland enacts what is called the Good Samaritan Law, or drug overdose immunity, which provides some protection against getting arrested or prosecuted, both for the person calling for medical assistance and for the person experiencing the overdose. And this immunity is intended to help reduce the number of overdose-related injuries or deaths by limiting the consequences that anybody may face when they try to receive medical help. So it's beneficial that substance abuse be viewed as a health issue rather than a crime. And without getting too far into a discussion about decriminalization, I will say that it has been shown around the world to decrease addiction and overdose. So people in the US who need drug treatment or medical assistance may avoid it in order to hide their drug use. So this second bullet point lists just a few of the organizations who support decriminalization for public health reasons and for equality reasons. The Affordable Care Act and the Americans with Disabilities Act treat addiction like a mental health issue, so people with addictions can still have equal opportunity and access to health insurance. In terms of Bronfenbrenner's bioecological model, Adult and Teen Challenge Baltimore might influence the first 4 levels. So microsystems, we have family, school, peers, community, neighborhood, church, and then Adult and Teen Challenge themselves are part of the microsystem. And then the mesosystem is the interconnections between those listed microsystems. Exosystem, we have policy, drug culture, drug business. Macro might be the laws, the culture, religion of the United States. And I would say that the Adult and Teen Challenge actually shuts off a few of the systems during their 12-month program, at least, like cuts off access to it. Because I mentioned before, I think, that the participants only have contact with their family members. So this excludes them from the peer microsystem, for example, which might have actually been one of the strongest influences on these participants' drug use. From a risk and resilience framework, Adult and Teen Challenge addresses many risk factors and either introduces or supports protective factors to counteract those risks. So first we have a lack of substance use prevention and easy access to substances. That's a big risk for abuse and addiction. So Teen Challenge would focus on intervention and puts emphasis on individual strengths to protect against use. Second, we have academic failure and social difficulties that may be a risk factor for some. And Adult and Teen Challenge provides protective factors including lessons and studies, as we've mentioned, and it's in a community of people who are facing the same issues. So there's a level of support there and understanding for their peers who are all undergoing the same rehabilitation together. Lastly, if parents use or abuse substances, or even if they don't, and the family just has poor relations, these could be risk factors leading to substance use or abuse for an individual with addiction. The organization supports family relations over any other, and they put emphasis on religion for families who would consider themselves to be Christian. My evaluation of the website is that they have adequate contacts available for those interested in the program or for those who wish to sponsor the students. There are many different ways to reach out. You can do email, call, or you can just send in your application. And this might counteract the lack of information I feel is on the site, because you could just call and ask any questions you might have regarding where you can stay during the 12-month program, under what living conditions, with how many other people, because that's information that's not currently available on the site. And I think the site in general needs updating because they're still in limbo between Teen Challenge and Adult Teen Challenge. And they have, like, for an example, they have testimonies from students 2 to 3 years ago that list them as expected 2017 graduates. That's kind of like, did they graduate? I don't know. But the program itself follows many of the guidelines Jensen and Fraser provide for effective programs, including a combination of therapies and other services, rehabilitating all aspects of the participants' lives, incorporating family involvement. The curriculum is developmentally appropriate for the targeted ages. The staff is qualified and competent in terms of human services, religion, and also for experience from those who were program graduates. And they provide extensive continuing care, as I mentioned earlier, for those who need it. I will say that it seems the organization might be exclusively religious. There's a portion of the application that asks if you identify as a Christian, and if you don't identify as a Christian, you probably aren't going to seek help from this site, and you possibly wouldn't even be permitted. And again, lastly, the organization lacks service to teens despite having teen in their title. So that about wraps it up. Here are my sites. Thank you for listening.